Hi, so I am here with Marci Coffey from Inland Empire Health Plan. I'm so excited to be asking you a few questions regarding the creation of the Inland Empire Community Health Initiative, or now as we're known as the IEHI. I, as program manager, have been with the organization a few years, and from our interim executive director, Victoria Stephen, I've learned some really interesting pieces about our creation and the beginning. But I would love to hear some things from you and your perspective since you were here at its creation. So when it came to the IHI, when it first came together, what inspired its creation?
Yeah, well, I have been here since the beginning, but believe it or not, the beginning started probably 2 months before I was hired. So I actually started at IHP in February 2006. It's a long time ago. And I was told that this was going to be one of my duties was to get this collaborative going. So it's technically the inspiration came before me, and I know it was sort of like a movement that really was happening across the state, and also something that the funders wanted to see. So we actually had a program, and I'm dating myself, I already did, called Healthy Kids way back in the day when kids were not covered on health insurance in the state of California by Medicaid or Medi-Cal. So undocumented kids, excuse me, I need to be clear. So undocumented kids were not covered. So many counties, including us and many plans, created their own program, and it was grant funded. So we had like both First Fives, so First Five Riverside, First Five San Bernardino. We had the Inland Empire Community Foundation. We had some funds from the California Endowment. Like we had funds from a lot of different funders again before I got here. And we created essentially a children's health product for anyone who was not eligible for current Medi-Cal and also was considered low income. And so our program was named Healthy Kids. And it was named that in other areas as well. And so that sort of started kind of that statewide movement and the collaboration of each of the counties that created their own Healthy Kids program. They wanted to collaborate, right? How do we share information, what's working, what's not working? And so that kind of started the impetus of the IEHI. And then also our funders said, we don't want to just give you money to keep funding these kids. There needs to be a long-term solution. There needs to be a policy solution. So like, what are you going to do besides providing this health insurance, which we're giving you money for? What are you going to do to, essentially try to inform policy so that these kids should be included into Medi-Cal in the future? And so that's essentially what started it all. And really at that time, it was all about kids and it was about kids coverage. And there were a lot of kids all over California that could not go to the doctor or would not go to the doctor, right? Because it was cash pay and or they could technically go to the FQs, but they weren't everywhere. And so really the momentum was around kids. And organically it's grown and it's changed and it's had, the tries have had to be nimble. Eventually it was a very exciting time when children were covered and added. And so then the next fight was, well, what about adults? And what about older adults? And then eventually older adults were covered, right? And with all of this, I'm talking mainly about the undocumented population. And so we're at this really exciting time now. Well, I guess I should preface that. We finally got everybody covered, and unfortunately, that is getting rolled back now. And it's like, it's really frustrating when I think about it because it's like I get excited talking about all the progress we made, and unfortunately, we are taking steps back now with a lot of what the current administration is putting out there for healthcare. But what was exciting, and one of the questions was who were sort of the key players. It really was the funders. It really was the health plan. It was the First Fives. The counties, both Riverside and San Bernardino County, also did put funds in. So it was really just a lot of people who in the region who care about kids and feel that all kids should have had access to healthcare. And that was sort of how it started, and then it grew. So eventually we had more players coming on board, and it was we used to do legislative advocacy. That was way back before IHP even had a government affairs division, which we do now. We have a wonderful one with Vicky Osterman, but we used to do it. And it was mainly about trying to make sure kids had access to healthcare in the beginning. That was our big calling order. Um, but yeah, it's exciting to see how it's, evolved and changed, and there's always something to fight for, unfortunately, and especially now. And so the Chais have really had to adapt to kind of what was the most pressing and what was the most current thing that they should be focusing on in California, in our region, and trying to have a unified voice. So there's a meeting that happens with the state level where all of the Chais come together and try to at least align a little bit what they're working on. But yeah, it's exciting to see what an amazing job we've done, but it's also a little sad when you think that some of that progress is being undone.
Absolutely. Thank you so much for your answer.